Hello there. Welcome to Pain Care Lab's PDQ videos. This is physiology and demonstration and then questions. Thank you all for joining. We've got about half of our participants, so I'm going to go ahead right now and start with a screen share to show you a little bit about the nature of plantar fasciitis. Today, what we're talking about is how to use VibraCool for your patients for plantar fasciitis. And we do, lucky you, have a patient here to demonstrate it on. So to begin with, I hope you will all register, click our other videos, check and see when there are issues, and we will let you know when there are new information available. We are starting a randomized controlled trial looking at specifically how long it takes for plantar fasciitis to get better with VibraCool. So hopefully we will have some new information shortly that we can share with you. So for right now, I am going to show you. So for plantar fasciitis, as I'm sure most of you know, plantar fasciitis is an inflammation or a pain that is stabbing in the end of the plantar fascia. So with VibraCool, we've got some traction for some of our other devices, for elbows, for needles. But today what we're talking about is the inflammation that comes below the plantar fascia that can cause heel pain. Now, the newest understanding is this probably isn't actually inflammation. But in the seminal work by Goff et al. That most people refer to, there are about 1 million adults a year in the United States who have this problem. The typical things that are recommended are ice massage and stretching. And if that doesn't work, which it doesn't for about 10% of patients, then what's recommended are orthotics and night splinting to get rid of the overuse and the pulling back and forth of the fibers in that plantar fascia. At the very end is cortisone, which is more for pain relief than it is to do anything for treatment. Now, the more recent understanding of plantar fasciitis is that it is thought to be due to degeneration in micro tears within the plantar fascia itself. So the idea now is that it's not actually an inflammatory process, but instead is a problem with repeated overuse. So where do you get repeated overuse? Well, as you probably know in your practice, repeated overuse comes when you have someone who is out of shape, who may not warm up well enough, who then starts new activity or new behavior. One of the places where this is really commonly seen is in the military. And Dr. Deanna Duran found that limb length discrepancies are actually highly related to plantar fasciitis. So if you have someone who has a slightly different limb length, maybe they broke this leg and so the bone grew a little longer, then what it means is that foot is perennially taking the greater stress of the pressure. Now that may be fine in day-to-day activities, but when you start wearing an 80-pound pack, then you start to get some issues that come from that. So what does that mean for plantar fasciitis? Well, it means that what we really need to be treating is overuse, not inflammation. And the problem with overuse is that you have blood flow limited in the plantar fascia area. So one of the problems is increasing blood flow. The next thing is that the micro tears, when they are injured, they release cytokines, they release inflammatory markers. And part of what happens is lactic acid is released that can stiffen those fibers and keep them together. So you want to do something that can separate these fibers, but a straight stretch may actually cause more micro tears and injury. If you use steroids on a regular basis, one of the issues is that you can have a risk of fat pad atrophy, and you can't use steroids too often for this problem for that reason. So there are two new energy options for curing plantar fasciitis. One is ultrasound shockwave therapy, and one is VibraCool. Now, what ultrasound shockwave therapy is doing is it's taking very small concentrated amounts of energy and it's blasting apart those fibers that have gotten stuck together with lactic acid and with overuse as it's trying to heal. When you have something like plantar fasciitis that lasts for a long time, you can actually see calcifications. You see calcium and bone starting to form to try to protect that and keep it from moving. So shockwave therapy is in very advanced cases where you can actually probably see some calcium on an X-ray, and certainly you can see some with ultrasound. And so trying to break those fibers apart is painful, but can be effective. A much less invasive way to use energy medicine is to use mechanical stimulation for this. So mechanical stimulation is anytime you have a source of energy, and the source of energy is, in our situation, mechanical stim. So what we have here is a device that has an eccentric flywheel that's placed on the body, and that placement allows the penetration of a mechanical stimulus. And what that's doing is several things. First of all, it's giving us a high flow vasodilation. So if you get above about 150 to 180 hertz, you start seeing a sympathetic response that causes blood vessels to dilate. So that improves the blood flow in this area of the plantar fascia. Second thing is that mechanical stimulation is going to separate those stiff fibers. So just like with shockwave therapy, but with a much gentler and lower amplitude stimulus, what you're doing is separating these fibers. One of the things that they found is that mechanical stimulation actually decreases delayed onset muscle soreness. It's about 3 times more efficient than massage and about 6 times more efficient than stretching. So using mechanical stimulation is a very intense and fast way to stretch out those plantar fascia muscles. And second thing is that ice. So yes, ice is going to help pain. You can see ice on this little middle area here going toward the brain. So ice is going to decrease pain through something called descending inhibitory control. But most likely what we're using it for here is that as we're separating those fibers, we don't want to start any more cytokine formation. So let's get to how we use this in the actual case. So VibraCool is a device like this, and this is where the high frequency stimulation is. So you can hear the high stimulation. It's about 200 hertz. What you're going to do is you're going to take a very specific plantar fasciitis pad, and you want to put the pad on top of this curve. So this curve is designed to fit into the plantar arch and into the arch of the foot. I'm going to have someone come here now and demonstrate. Great. Put a foot on up there. So, yeah. All right, there we go. All right. So plantar fasciitis is going to be like right in there, the middle side, typically stabbing pain. So the VibraCool is shaped to fit exactly in that area. So you can see here. So what we're doing is you want to have the patient position it so that this end, we say put the shot near the dot for podiatry, but this end is going to go right where that arch is. Now, in order to do a combination of ice and vibration like this, you're going to have to attach it. So just to show you really quickly what our instructions show, this is the way that you hook the VibraCool up. So you're going to have the ice pack. You're going to first of all feed the strap through the ice pack, then you're going to feed it through the unit itself, and then you're going to wrap it around. So to show you what that looks like in real life. All right, so here we have the ice pack. So first of all, you're putting your strap through the ice pack. Now, this side is going to be more cold than this side. So if you've got a really intense pain and someone who can handle it, you want to put it through so that this colder side is going to be on top. All right, now what you're going to do is you're going to take that and put it in through until you get to the other side, like so. And then we're going to take this and go through the ice like that. All right, now mind you, the ice pack should be frozen for use, but this is how it hooks together. So for a patient, what they're going to do is they're going to position it, again, with this end, the active end, as close as possible to where the plantar fascia is inserting, and then put it like that. All right, so this is the way, and then they're going to activate the vibration and just sit with it for about 20 minutes. Thank you so much. Oh, you're lovely, lovely foot model. So let's talk a little bit about that, and feel free now to ask the question part. So you've got the demo, you've got the physiology, but going back to our slide deck to show some of what we expect and what we see with this. After the VibraCool is on, and we do have a new strap which will allow someone who is up to a size 14 to be able to use the VibraCool. So big basketball players can use this. The area where you're focusing the attention is really small. It doesn't matter, but you can see on this how the VibraCool strap has a lot of extra room on it. So our suggested use is 20 minutes twice a day, and it could go up to 3 times a day if someone has a very bad case. And certainly if they have any periods of sitting, it's better to use it before they start moving around. We notice a clinical difference within days of decreased pain. And for patients who have gone through the whole route of steroid injections and shockwave lithotripsy, those guys are going to need probably a full month before they notice that they really don't have any pain anymore. So that's for the best results, is to get that. For the m-stim technology, there are over 50 published clinical trials. Now, with the plantar fasciitis, there was a case series of 10 patients who were resistant to treatment. They noticed 50% less pain and 30% more pain-free days. This was the work by Deanna Durand, as I mentioned. And one thing she said was that it seemed to work better to have 20 minutes twice a day than 10 minutes 3 times a day. So again, having a longer session less frequently worked better. There are a number of other studies that have been done for physical therapy, podiatry, and those will be on our website, and we will have other webinars around them. I think the most important thing to keep in mind is that while your results may vary, we've got some really hard cases who have used VibraCool and found that they don't end up noticing their foot pain, and then the pain goes away. This is one of the reasons we're doing a randomized controlled trial, because when you quit feeling pain, you forget that it was a big deal to you. And sometimes you're like, oh, you know, I haven't hurt for a month. So that is our information about how to use VibraCool. If you want to get VibraCool, we have them available on Pain Care Labs and the FSA HSA store. This is the plantar fasciitis unit, and I would be delighted to take any questions. But otherwise, thank you so much for joining our webinar. Please ask any questions and come visit us at our YouTube channel, Pain Care Labs, and click any of the other informational things we have about physical therapy and how to use VibraCool to get over your pain. Anyone have any questions? Thanks so much for joining us.